So I am certainly tasked with keeping up with the information, keeping up with the data, keeping up with the misinformation is actually a new part of my job, and addressing the misinformation. And so I appreciate you all having me back. In terms of a COVID pandemic, March of 2021, when I was last here, was a long time ago. That was a long time ago. And so I am happy to come today to kind of answer some of these questions. So the first question was, why are we having all these variants? Well, we're having all these variants because of you and me. We're having them because of our behavior, right? This is a behaviorally driven pandemic. And the reason that I say that is that by and large, as a society at whole, we have not followed public health measures, meaning masking consistently, washing our hands, practicing social distancing. We've had tons of misinformation, and it's certainly been politically, it's been politicized, and there's a certain ideology as well that people are following, that somehow science has gotten mixed up in that. And so the reason we have more variants is because as human beings, we are the host of this virus. The virus doesn't live without us. It cannot survive without us. It leaches onto us. And so when it invades our bodies, it replicates, and then it has the propensity to develop mutations, which are actually errors in the replication. So it creates a little error in its replication process that then changes the virus's capabilities just slightly. And that's a mutation. Sometimes these mutations are harmless. Sometimes these errors can actually weaken the virus and make it extinct. And sometimes they can make it stronger, or it can develop certain new capabilities that it didn't have previously. When we talk about variants, I want us to understand that we are now talking about variants. In March, we were talking about mutations. So what's the difference? A mutation is just what I just said. It's a copying error, where there is just a slight error in the replication process. That's a single error. A variant is a collection or a cluster of multiple mutations that have all come together to actually create a brand new version of the virus in comparison to what we now term as the ancestral strain. So that's how long, this year and a half, we're already talking about the ancestors of this current variant. So the Delta variant is not the same virus as the SARS-CoV-2 virus that originally caused COVID-19, that we're all talking about COVID-19. In fact, you should think about this variant. COVID-19 was named because the first case was diagnosed in the year 2019. So it's called COVID-19. We should actually think of the Delta variant as COVID-21. This is the new updated variant, the new updated virus. It's sleeker, it's stealthier, it's deadlier, it's faster, it's more transmissible, it's sneakier. This is COVID-21. That's how you should think of it. We are no longer dealing with COVID-19. That's gone. That ship sailed. We missed it. We didn't manage it when we could. Now we have COVID-21. This is a brand new version of the virus. This is not the same virus. And so the reason we continue to have these variants is because if we continue to have pockets of people or populations that are either unvaccinated or unwilling or unable, for whatever reason, to follow public health measures, then the virus is going to find you. And then what does it do? Invades your body, replicates, mutates, and we start to get these super mutations. That's really what variants are, super mutations. And what happens is eventually that runs the risk of putting all of us at risk, including those who are immunized, because these new variants that develop in these populations where people are not well vaccinated or well protected have the ability at some point to evade or overcome the immunization status of the rest of us. And so not only do we have to start over again at square one, we start behind square one in negative numbers because we're not starting over with our original virus. We're starting over with these more virulent viruses against which these vaccine companies will now have to create new formulations, not booster shots. These would be new formulations to combat the currently circulating variants that were not even in existence when all of these clinical trials were being done. So we are the drivers of this pandemic. It is completely being propelled and perpetuated by human behavior.
Now, so as far as the variant and originating, someone had a question saying, does it form in a human who already had the COVID and does it affecting others?
And so it can. And what we know about people who have natural immunity, meaning they've already had a COVID infection, versus those who have vaccine immunity, we know that the natural immunity is not as high, it's not as strong, and it doesn't have as broad a coverage against new variants. So you can be infected and have recovered from COVID in March of 2021, which is like 15 years ago in our old terms, and then get infected with the Delta variant. Because that's a new virus, remember? This is a new version of the virus. So you can be reinfected. Your immunity may not protect you against this new version. What we know is that the vaccine immunity is holding a much higher protection against this current variant currently, because new variants will come if we can't get our acts together. And that is going to give you a stronger, broader, more consistent protection, not 100%, but much better than your native immunity. Native immunity is not bad if the disease doesn't keep changing. But because this keeps changing, you have an immunity to a version of the virus, which may or may not extrapolate to the new versions of the virus that are coming out. So that's why we want all people, regardless of whether you have been infected with COVID or not, to step forward to take the vaccinations, because it's independent of vaccine consideration.
Okay. Now, can somebody that's vaccinated spread COVID-21 or the strands to someone else to get the virus?
Yes. And so, and I want to say, thank you, Iris, for asking that. So again, COVID-21 is not a real thing. That was an example I was using to make a point, and you're welcome to use it, but I just want you to know, if you go and Google COVID-21, you won't find it. So, but I was making a point that that's how we should begin to think about this in terms of this is a new updated version of COVID-21. And so if you were infected with this Delta variant and you've been vaccinated, we now know absolutely that you can pass this virus on to others. The reason for that is this particular variant, again, this is not the original virus. This is a new and improved version of the original virus. Wow. The original virus wish it could work this well. So the reason that if you are vaccinated, we now know that you can pass this virus on to others is because the Delta variant carries a viral load, meaning the number of viral particles that are in your throat and in your nose when you are infected. It carries a viral load more than 1,200 times higher than the previous variants. That is incredibly infectious. The reason prior variants, we weren't concerned with vaccinated people passing it on is because the viral load would be so low in people who are vaccinated until it's highly unlikely that you would pass it. Even if you contracted it with the vaccine and you were asymptomatic, you didn't have symptoms, or you had mild symptoms, your viral load, your vaccines are keeping that viral load so low that you really can't transmit it. The viral load determines not only how contagious you are, but also how sick you may be. The higher the viral load, that just means that's that many more COVID particles in your body. So you want as few as possible. The fewer that you have, the less likely you are to be sick. And in this case, the viral load of the Delta variant is so high that even people who are vaccinated, even though the vaccines are protecting them by and large from serious illness, it doesn't protect them from carrying that viral load. And so that's the difference. And that's why I say this is a new and improved virus. The vaccines will protect you from hospitalization and death. And even though you may have some symptoms, by and large, most people who are vaccinated will not be admitted to the hospital. But we also now know that you are highly contagious, the same as an unvaccinated person. And even though you are protected and you feel pretty good because you got a vaccine, so you're protected, you can pass it on to other people, like your children at home.
Yeah, and we hear a lot of that today now about the children, getting the virus and spreading it to their parents. And also, I had someone mention that they said the news is reporting that if you are 65 and over, you should receive a booster shot for the Delta variant. Is this correct?
So the news is putting that out, but we, as a scientific community, still have not embraced that yet. We are not looking at boosters. We're still trying to get everybody vaccinated before we move to boosters. The issue is not the boosters. The issue are the unvaccinated people that are driving this pandemic. So we don't want to keep working on one end when it's the other end that is creating these issues that are moving forward. Currently, what we know is that all three vaccines, while a lower efficacy against this Delta variant than their previous variants, still that efficacy is very high and higher than a native immunity. So at this point, we are not moving towards boosters. We are focusing on getting the unvaccinated to get vaccinated because they are the ones who are driving this pandemic, driving the numbers of hospitalizations, driving the deaths, driving the morbidity, and continuing to keep us in this sort of gridlock, this trap that we can't get out of. And so that's why we're focusing there and not so much on the booster. So as of now, 65 and older, we still aren't recommending it. I'm sure you can go many places and get one. Your doctor will probably give you one or something. I don't think there's any problem with that. What I will say is if you get a quote unquote booster, don't forget, this is not a formulated booster from the vaccine company. You're just getting a third shot of the same second shot that you already got. It's the same thing. And while that could be helpful, what may be needed is actually a new formulation for these quote unquote booster shots, such that they can be effective against these new variants. So that's why it's unclear whether boosters are going to help. The booster is the exact same shot as the others, but now we're in a completely different ballpark.
Okay. I have a question of people saying, how are people who are vaccinated getting this breakthrough COVID-19?
So don't forget, great question, by the way. No question is a bad question, so I just want you guys to know that. So don't forget, the vaccines are not 100%. No vaccine is 100% ever in the history of mankind. So you can still get COVID, more so with this Delta variant than the previous ones because of that high viral load. Those are these so-called breakthrough infections. You are testing positive for COVID even though you've been vaccinated. But here's the point to make. Your vaccine is protecting you from the more serious effects of that disease. So you getting a breakthrough infection with the Delta variant and you're vaccinated versus your neighbor getting infected with the Delta variant at that 1,200 increased viral load, and they are unvaccinated, we've got two completely different medical courses going to occur. So your vaccine still is protecting you from the more serious aspects of this disease, which is death and hospitalization. And so that's why we want to continue to get this vaccine. Unfortunately, though, if you're vaccinated and you contract the Delta variant, you are contagious to others.
Okay. And so you're definitely recommending that anyone vaccinated continue to wear their masks so they don't get exposed to like the Delta variant.
If you are vaccinated and you are indoors in an environment with unknown vaccination status of other people, then you absolutely should put on your mask. Okay. Not only to protect you from getting COVID, even though you may or may not be sick, to protect you from taking it somewhere and giving it to somebody else, like a child, even though you're not sick. So you need to gauge your environment. If you are somewhere and you absolutely know everybody is vaccinated. So for instance, and I'll just make it up, you're at work and your requirement for work is that everybody's vaccinated or you can't come to work. So when you're at work, if that's the requirement to be there and there's someone who's enforcing that or some entity that's enforcing that and ensuring that the only people who are walking through those doors and are within your office space are vaccinated, then you can be unmasked in that environment because you know that everybody is vaccinated. But if you are somewhere else indoors and you're in a situation where you're not sure of the vaccination status, then I would suggest that you put on a mask. Right.
Definitely, I agree. Now, what are your thoughts on the rise of the COVID-19 cases infecting people who are unvaccinated? Because you're seeing that a lot now in the hospitals where they're saying that people that are being treated in the ICU, they're unvaccinated.
Make no mistake, it's the unvaccinated that are driving this infection. We have seen the caseloads in our hospital in the last 5 or 6 weeks, I don't know, go up eight times. This is crazy. We are having the same peak that we were having back in February of 2020. And maybe we might even see numbers approaching when we were at our most extreme. This is now our 4th surge. The last 2 surges clearly have been driven by human behavior. What we see in the hospital are the unvaccinated coming in. What we see in our ICUs are the unvaccinated, the people who have tubes down their throats, who are intubated and on breathing machines are the unvaccinated. That causes a risk to the rest of us, the vaccinated community, because now we know that this particular variant, don't forget, this is a new virus. I'm using that term variant. Now you know what that means. This is a new virus. This particular variant, COVID-21, still has the ability to infect us, even though we're vaccinated. And our vaccines are protecting us from being sick, but the next variant might not.
Might not. Oh, wow. Okay, now what is your advice for pregnant women, cancer patients, children under the age of vaccine availability, and children who are eligible for vaccines. What advice would you give these group for protecting themselves on a day-to-day basis?
So for pregnant women, I think it's been pretty clear. The American College of Obstetrics and Gynecology, the Society of Fetal Maternal Medicine, and the Society of Reproductive Medicine, and the CDC, and the World Health Organization have all come out to say very clearly that pregnant women should be vaccinated, that the risk to pregnant women of getting COVID is so much higher than your risk ever would be of getting vaccinated to both mom and the baby. I think that's pretty clear. A pregnant woman who becomes infected with COVID, and specifically with this Delta variant, has a much greater risk of injuring herself and a negative outcome for that baby than if you ever would have just taken the vaccine. So I think that's pretty clear. We have over, I haven't checked in a while, 130,000 pregnant women that we've been following in the vSafe app. And so far, no signals whatsoever. And so for pregnant women, I would encourage you to move forward and be vaccinated to protect yourself and to protect your unborn child. For cancer patients, I think that was your next patient.
Right.
Your next question. Absolutely, cancer patients should all be vaccinated. I can't even think of an exception. You are incredibly susceptible. If you were to be sick, if you were to be infected, your reserve is so much less. Your risk of death is so much higher. I can't even think of a reason that a cancer patient would avoid this vaccine. One thing that people ask me is, I'm taking chemotherapeutic agents or other types of medications because of my cancer that suppress my immune system. And so that's a valid question. What we don't know, it's not whether the vaccine will harm you. What we don't know is whether or not the vaccine can even mount an immune response in cancer patients who are taking chemotherapy, because the chemotherapy itself fights to reduce the immune response. And so we've got trials ongoing right now just to determine if you mount an immune response. If so, how high is that immune response? Is it the same as people who are not on chemotherapy? Is it different from people who are on chemotherapy? And so that's the question on cancer patients, not should you take it.
Mm-hmm.
The answer is yes, you should take it. The question is not should you take it. The question is, how great of a immune response am I mounting if I'm a cancer patient on chemotherapy? And that's the question that we're trying to answer. So we absolutely want cancer patients, even though you have been vaccinated, to continue to wear your mask, continue to practice social distance measures, unless you are absolutely certain that everybody around you is vaccinated, because you are incredibly vulnerable. Your health status is vulnerable. And we don't know if your immune status after vaccination is as high as the rest of us. We don't know that. We're trying to find that out. That's the question, not whether or not you should get the vaccine.
Got it. And these three questions here all are having to do with the vaccines, and they're true or false. On the Pfizer vaccine, is 88% effective against the Delta variant and 96% effective against hospitalization from Delta after 2 doses. Is this true or false?
True.
True.
Mm-hmm.
Okay. Moderna is 100% effective against the Delta variant. True or false?
No, false. Nothing's 100%. No.
That's 100%.
Yeah. So Moderna is probably 84 to 88%
Mhm.
against the Delta variant.
Okay. Johnson & Johnson, this vaccine not as effective against the Delta variant. True or false?
So I would say that's false. And I would say, because we don't have a lot of information on it, the fact of the matter is most of the breakthrough cases that we are seeing have been from the messenger RNA vaccines and not Johnson & Johnson's vaccine. So it's been from Moderna and Pfizer. And don't forget, Johnson & Johnson is a viral vector vaccine. So is there something with the viral vector vaccine that confers a little bit better protection on the Delta variant? I don't know the answer to that. Johnson & Johnson hasn't been that transparent with exactly what their data is on this Delta variant. What I will say is what I have seen, and I haven't seen all of it, but the data that I'm able to get my hands on, most of the breakthrough cases are occurring in Moderna and Pfizer patients and not Johnson & Johnson patients. Now, in some ways, we might expect that because most people received Moderna and Pfizer. We have a smaller proportion of people who received Johnson & Johnson. So maybe we would expect to see most of the breakthrough cases, right? And Moderna and Pfizer, if most of the people received it. But we don't know the answer to that. And so I would like to have Johnson & Johnson have more transparent data as to where they are with neutralizing antibodies and this Delta variant. And I would like to see the CDC and the Department of Public Health specifically publish in breakthrough infections which vaccines these people receive. The data that I see, and I just see spotty pieces of data here and there, but as I'm looking through it, it appears that these breakthrough infections are occurring in patients who've received Moderna and Pfizer. I do not see Johnson & Johnson breakthrough infections. Again, I say that with the caveat of I clearly haven't seen the entire compendium of data. I just see snatches of things. I'm hungry. I'm always looking for stuff, but I've never seen all of it. But in my mind, I'm thinking, is there something with this viral vector vaccine that is protecting these people from breakthrough infections with the Delta variant? Or is it, something about the way that they're living or the way that they're eating? I have no idea. And I don't have the information from Johnson & Johnson. So I would say we don't know. I am seeing data that is making me, that is of interest to me with regard to how well the messenger RNA vaccines are working versus the viral vector vaccines for breakthrough infections. And I'm seeing more breakthrough infections in Moderna and Pfizer than I am Johnson & Johnson. That's just line. That's what I'm seeing.
Now I've got a lot of questions coming in now. So here's one.
All right.
It's a comment. It says, there seems to be a disconnect between the guidance for vaccinated people and the recent Kaiser Family Foundation report. Mm-hmm. On the other hand, and the anecdotal information about breakthrough infections of vaccinated people, such as the outbreak starting at a Hong Kong airport, multiple outbreaks in healthcare facilities in India, gold mine outbreak in South America, the Providence and Massachusetts outbreak, etc. Should our firm consider protective steps beyond current CDC guidance?
Okay, that was kind of a loaded question. So I'm trying to kind of understand it. And so here is what I would say, a recommendation I would give for your firm. We know that, vaccine mandates maybe are not popular, but I certainly support if you're going to be in a work environment that everybody should be able to feel safe and comfortable and free of harm, and that someone else's decisions and choices are not negatively impacting my health. So for instance, you wouldn't allow the person sitting in the cubicle next to me to smoke, because even though I'm not smoking, I'm going to smell that smoke. And we now know that secondhand smoke increases the chances of cancer just as much as the person who's smoking. We know many spouses of smokers had diagnoses of cancer just as often as the spouse who smoked. And so we wouldn't allow that. So why would we allow someone to make a choice to that could then negatively harm my health? And so for businesses, I recommend that everybody be vaccinated such that everybody who comes to work can feel comfortable and safe in their work environment. Those who don't want to get vaccinated, maybe stay at home or mask. But the reason that I say generally stay at home is because who is going to enforce who's wearing a mask at work and who's not wearing a mask at work? And it just starts to get, at some point you got to actually do your job, right? We can't do these things with masks. So my recommendation is to create a safe environment for everyone. And for people who comply, then they're able to come in and be able to relax and go back to working the way they usually work. People who are not vaccinated, I don't agree with the frequent testing and the masking, because it creates another layer of who's going to enforce that. At some point, the person takes off their mask to drink water, to have coffee, to eat. They forget to put it on. They sneeze somewhere. I mean, it just starts to get to, outrageous. And so that would be, that's my recommendation. I know it may or may not be popular, but I think that's the only way to make certain that people are safe, and such that they're making choices to come to work, they know they're making a safe choice when they come to work, so that when they go home, their families can feel confident that wherever they've been that day, my mom, my dad, whoever have made safe choices for me, and I'm able to come home and take care of my elderly parents or interact with my family. And I'm not putting them at risk because somebody at work was putting me at risk. So.
Right. Good. This question, if the prior definition of close contact was 15 minutes, so the definition of close contacts be now 15 minutes divided by 1200 or less than 1 second?
So I think what you're talking about is time. So previously we said the exposure time is about 15 minutes of exposure. And that was even at a 3 to 6 foot distance. But now we know, in order to risk infection, but now we know, even with this Delta variant, the time is 1 minute. 1 minute of exposure. Big difference. That's why I call this COVID-21. So it's no longer 15 minutes of exposure. If you're around a person for a minute or less, then you have a risk of contracting this Delta variant. That's how high the viral load is.
Okay. Now this one has to do with children. When do you think the kids vaccine will be available for children under age 12?
So I just had a meeting with Moderna about this last week. They have had to go back, Pfizer as well, on FDA recommendations, and increase the size of their trials. So they now are adding more children. So we're looking at something closer to maybe December, which is why, December is a long time in pandemic calendar. So it is important for us as adults to get our acts together. December is a long time from now. And our kids are depending on us to do the right thing and make certain that they are safe and in environment. We're working as quickly as we can to develop these vaccines, which is why the FDA wanted to expand the number of children in these trials, and therefore the trials probably would not go before the FDA before November or so, and maybe emergency use authorization in December. Hopefully, I'm surprised and something new will come out, but that's my latest meeting with Moderna and what they're thinking.
Right. Now,
we have some questions on this Q&A board that I see here too, Iris. I just didn't want those to be ignored.
Well, these are the ones I'm asking now.
Okay.
Over to the right. Now, this one has to do with, so when do you, that's about the children. This one says, if we want a booster, should we let Johnson & Johnson, or should we get Johnson & Johnson if we had a Pfizer vaccination?
So, so this question of boosters is still out there, and we don't know the answer to it. And there's been a lot of discussion of, if you had Johnson & Johnson, then you should get a booster with Moderna or Pfizer, because they have broader efficacy. Again, I'm not sure I agree with that for a number of reasons. And I think I gave you one of them, that I'm not seeing breakthrough infections so far in the Johnson & Johnson vaccine. And number two, don't forget, even though Moderna and Pfizer have better efficacy, meaning how well it works, than the Johnson & Johnson numbers, it's not really comparing apples to apples, because Johnson & Johnson came later onto the market. So when they were conducting their clinical trials, all of those more virulent variants were in the atmosphere, the UK variant, the South African variant, the Brazilian variant. Moderna and Pfizer didn't trial their vaccines against those variants because they didn't exist.
Mhm.
So it's very hard. And Johnson & Johnson was a single dose. I often think if Johnson & Johnson had designed its trial as a two-dose vaccine, we probably would have seen the same level of efficacy. I would lean towards, because of what I just said about designing their trials as a two-dose vaccine, if you received one dose of Johnson & Johnson and you are thinking about a booster, that you get the second dose, which brings you more in line with the way Moderna and Pfizer were dosed. That's what I'm thinking. We are not moving towards boosters, I guess, at this point. That's what I'm saying. And I guess what I'm saying is I don't see a reason currently why Johnson & Johnson would have to have a booster with Moderna or Pfizer, because the Johnson & Johnson was just a single dose vaccine and actually showed much greater efficacy as a single dose vaccine than one dose of Pfizer and one dose of Moderna. That's why they moved forward. So their formulation was actually stronger than Moderna and Pfizer's. And so they decided to move forward as a single dose. In doing so, their overall efficacy became less, because Moderna and Pfizer then supported themselves by providing that second dose. And so as a scientist, then I wonder, then if the Johnson & Johnson people came back to get a second dose, what that would look like as well. So the answer on boosters is out. People smarter than I am are going to kind of make those decisions. But the Johnson & Johnson bashing that I see in the questions, I just don't see science to see that. I don't see breakthrough infections in the Johnson & Johnson vaccine. It has much better efficacy after a single dose than a single dose of Moderna and Pfizer. That's why they have two doses, because it wasn't working that well after just one dose. So in many ways, it's a superior vaccine. Unfortunately, it's going against vaccines that are giving two doses when actually it has better efficacy after a single dose if you compare a single dose of Moderna and Pfizer. And so maybe they need to come with two doses. So that's probably a very complicated discussion of, we don't know about boosters yet. We don't know. What we want is to get everybody vaccinated, so we don't really have to talk about boosters at the moment. So that's what we're trying to prevent more variants from emerging.
And now, what about some people who, with the Pfizer and Moderna, you're supposed to get the two shots. And
Right.
some people say, well, I'm just going to get the one.
Yeah, that's nuts. So I'll just say that's nuts. I want to say it again. That is completely nuts.
Yeah, I know a lot of friends that say, I just got the one. I'm
You
not
are
going to get the second.
incompletely vaccinated and a risk for being a part of the problem of developing more variants, even maybe more so than the unvaccinated, because you can be more easily infected. And because you have some of that vaccine on board, that allows the virus to learn a little bit more about that vaccine in your body.
Okay, got it. Okay. Here's another question. Do you think schools should close due to the current Delta spreading quickly?
So, the school question has been, so tough. Kids, parents, everybody's been at home. People are exhausted. Kids didn't learn. There are mental health issues. There's been suicide in children, depression. And so, we certainly understand the need. The need to be back in a socialized environment with other human contact and not isolated in these webinars and this computer technology. We found out more about how social we are as a society and as a species, actually, than we actually thought that we were. And that is a part of your growth and development, that is a part of education, that is a part of health. On the other hand, we also know that there are not vaccines available for children. We know that children are in mixed households, meaning some are coming from vaccinated households, some are not. We know we have children that are mixed ideologies. Some are coming from households that are supporting vaccine and mask mandates, and others are not. And so, once again, just like your work environment, that puts all children at risk. It puts the teachers at risk. And so what is the solution to that? The solution is for currently all the teachers to be vaccinated, all the administrators to be vaccinated, all the cafeteria workers, all of the janitors, all of the librarians, every single adult in that facility, in that school system must be vaccinated to create that environment that is safe for the children to come into. That being said, there will be many children who are coming from unsafe environments and still could bring it with them and spread it to other kids. I think at this point, schools can be open, but I think it's a slippery slope, and we are, we could be headed for disaster in these schools because we're not mandating vaccines for all of the people who work there, and we're not mandating masks for children that we know are coming from different environments. So I anticipate that the school environment I anticipate actually not a good outcome there. And so we will see. I do understand the need to be there and the need to socialize, and hopefully people will wear masks and teachers will encourage children whose parents are discouraging them to wear masks in the household, but parents have been very strident. And again, this is very ideologically driven and not scientifically driven. And so, unfortunately, I'm not anticipating good things that are going to happen in our school systems.
So that's really all the questions I have. But in
I
closing,
see some questions here. It says, how risky is it to attend an event like a wedding? Would you attend such an event? So I would ask a couple questions. Is the wedding outdoors? Wedding's outdoors. Okay. Are you going to be able to, stand away from people? If it's outdoors, can you spread out? Is it on a beach? Those kinds of things you have to think about. Obviously, if you're going to a wedding, unless it's very small, everybody there are going to be people there who are not vaccinated. And there are going to be people who are not vaccinated and don't really care about you and whether they're vaccinated. So you've got to care about yourself. If the wedding is indoors, I would absolutely, if you decide to go, wear a mask at all times. I would not remove it at all. If you are indoors at this wedding with people of mixed vaccination status, I would absolutely wear a mask at all times. If you are outdoors, you have a little bit more freedom, but a wedding and a funeral are similar in that there's a lot of hugging and kissing and tears. And so even though you're trying to stay away from people, people still may be up closer to you than you would like. And so you may even want to think about having a mask on outdoors as well. You also have to think about your personal situation. Who do you go home to? Who's depending on you? What are the risks in your household? Is anybody sick? Is anybody vulnerable? Blah, 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 blah. So these are all considerations that you would have to think if you would like to go to the wedding. I'm not saying not go. I'm saying assess the situation, assess it, and then make a decision of how you can mitigate your behavior and whether or not then you still feel comfortable going.
okay. Now, do you see some more? Because I don't have any more.
It says, can you speak to the Cape Cod outbreak and what it means and doesn't mean? And I haven't been following it carefully, but it looks as if in an area of the country where there was a high vaccination rate, they still had quite a few breakthrough infections. And in fact, because of that, those breakthrough infections at some festival that they attended, and everybody was unmasked, and because it was by and large outdoors, and it was an incredibly high vaccination rate there in that area of the country. So people were enjoying the freedoms of being back at their life. And they had a big outbreak of a Delta variant. And I think, yeah, actually, I actually can't remember. Maybe it's like 70 something or 90 something people actually became fairly ill with this Delta variant. A few others, many others also tested positive. And it was because of that outbreak, that information is what fed the data for the CDC a couple of weeks ago to come back and reinstate mask mandates for the Delta variant because of what they learned from that Cape Cod outbreak. That's how they learned that the viral load was so much higher. That's how they learned that it's 1 minute of exposure and no longer the 15-minute rule. So the Cape Cod outbreak served as the lesson and the data that the CDC studied and used and said, you know what, we've got to go back to having a mask mandate for the vaccinated. But the tragedy of that is that it's the vaccinated who are masking and the unvaccinated who are still unmasking. So the vaccinated are having to mask to protect themselves from the unvaccinated. Because don't forget, the unvaccinated were supposed to be wearing masks, and the vaccinated were able to not wear their masks. And so the Cape Cod outbreak started somewhere in an unvaccinated individual. And that's how we learn that. Unfortunately, because now in our society, up is down and down is up and right is left and left is right, the vaccinated are actually retreating back behind the masks because the unvaccinated are continuing to drive this Delta variant and drive these infections. And the vaccinated must protect themselves and protect other people around them from this type of behavior.
Now, what if you have a household where you have the wife decided to get the vaccination, but the husband decided not to get the vaccination, or vice versa?
Right.
And you have your children. How do you handle that type of scenario?
Yeah, I mean, those are just you all's personal considerations. You know, most people still aren't going to wear a mask in the household when you're around your family. But there are many split households like that. And so the best you can do is to maintain as many safe behaviors for you and your spouse and your children as you can. So, that those are all personal management things in your life. You're going to have to just figure out how to manage it. Obviously, we would like to have everybody vaccinated. We have resources for people to talk to people, including me. And so that is, a personal situation that you'll have to manage just at home. But that is considered an unvaccinated household if the adults in the household are not all vaccinated.
So in leaving today, what would you like everybody to keep in mind and practice and do going forward? And, do we have something, do you see light at the end of the tunnel as far as one day you not have to go through all of this with a mask and vaccinations? I know.
Yeah, and so I'm going to answer just one more question that I see. Is a flight a low risk if masked the entire time? If you need to travel, I would say absolutely keep your mask on. The airports are requiring masks. The airlines, I know a couple of flights that I have been on a month and a half ago were requiring masks, and I selected those airlines because of that mask mandate. And they were clear, and they came on the intercom and said, you will wear a mask or you will face prosecution. They were like really clear. I loved that because we are now in a sealed tube. And we cannot have the Delta variant. Do you know how quickly the Delta variant on a 3-hour flight can circulate in a sealed tube? So I would say pick an airline where they are absolutely stating and being clear about it that you will wear a mask. And then you can feel comfortable, I think, on these flights. I even wonder if airlines are going to ever go back to taking off masks. I think, no matter how well you're circulating the air, et cetera, you're still just in a tube with 250 other people who are bringing everything with them. So just something to think about. If you can avoid the flight, do it. I'm not saying change your life, but if for whatever reason you're going, even for business or even just for pleasure, I would say go on an airline that has a mask rule, a mask mandate, and travel back and forth on that airline. And you also comply. Make sure your mask is on. Make sure you're vaccinated. And so that's what I would say. And so my last thing, Iris, into answering, we'll close it down, is Certainly we absolutely want to avoid death. And I think if you're serious about avoiding death, then you have to be serious about considering these vaccines, because this virus is seeking you out. It's like a heat-seeking missile. This is COVID-21. It is seeking out the weak and the vulnerable. And if you are an anti-vaxxer and you never get vaccines, and so you're not going to get this vaccine, and look at me, I'm always healthy. I've never had a vaccine. My mother's never had a vaccine. We've never had a problem. Think about this. The reason you've never had a problem is because I got my vaccine. It's because you are surrounded by a herd in the United States where the majority of people are immunized. Because of that, there is no area via which these diseases like measles, mumps, rubella, chickenpox can penetrate, because the herd in which you have the privilege of living is immunized and protecting you. You don't have some type of higher evolved immune system than the rest of us. You don't have some type of higher level of thinking, nirvana, that has placed you immune to diseases. You haven't found the perfect cocktail of vitamins that you're taking every day. Look at me, I don't need a vaccine. No, you're healthy because I took my vaccine. You're healthy because you're counting on me to make sure that I'm healthy and that my family's healthy and that my children are healthy, so you can walk around unvaccinated and be safe. At any point, if we reach a percentage of the population that is unvaccinated, you will quickly determine, you will quickly realize that the unvaccinated are not that healthy and are not impervious to disease, because they will quickly get diseases, and people don't remember the devastation of measles because of vaccines that kill thousands of children every single year. So people who don't receive vaccines do not have any special health status. They enjoy the freedom of not being vaccinated because people like you and I have chosen to be vaccinated, and we therefore protect them. So I want to thank you.
I never thought about it like that. That was very good closing. I like that. Very good. Very good. Very good. So thank you very much for coming to give your presentation again. We've learned even more now, and we know what you do going forward, and make sure we take it all in.
Thank you, Iris. It's always a pleasure. Guys, reach out to me anytime. Follow me on LinkedIn, Instagram, Twitter. I try to keep the information out. I try to in fact, I don't try. It's always just science. And I do something called Stairwell Chronicles. And on Mondays, I always, or at least I try to generally publish something, a 1-minute video addressing one piece of misinformation. And I talk about the misinformation, and then I talk to you about why that's not true. Generally, it's something that's circulating on social media, and I'll talk about it on Mondays. It's called Monday's Myths, and it's a part of my Stairwell Chronicles series. So tune in.
All right, then. Well, thank you very much.
All right.
Bye-bye.
Bye.
Bye.